Welcome to the Victory Education Lounge, your premier hub for insights and guidance on the US medical residency application journey. If you're gearing up to navigate the residency interview process, you're in the right place. In our video, can you describe a challenging situation you faced in medical school and how you dealt with it? We'll walk you through each critical step of the process. So if you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of residency interview questions and move one step closer to your residency goals. First up is the teamwork challenge. Picture yourself in a bustling hospital or a busy clinic surrounded by a team of professionals, each with their own roles and responsibilities. In such a dynamic environment, teamwork isn't just a nice-to-have, it's a must-have. It's the glue that holds everything together, ensuring that patients receive the best possible care. Now, let's imagine a scenario. You're part of a group project in medical school or perhaps on a clinical rotation. You're working closely with others and, naturally, differences in opinions arise. Maybe it's a disagreement on the diagnosis of a patient case, or perhaps it's a clash of personalities that's causing tension within the group. When faced with such a challenge, the interviewers aren't interested in the drama. They want to know what you did about it. They're keen to understand your role in navigating the conflict and bringing about a resolution. Did you take a step back, or did you step up and take initiative? Did you contribute to the tension, or did you help to diffuse it? As you craft your response, focus on your actions. Describe how you encouraged open communication, promoting an environment where everyone felt heard. Discuss how you facilitated collaboration, perhaps by reminding everyone of the common goal, the patient's well-being. Mention how you played a role in conflict resolution by mediating between different parties or suggesting a compromise. But remember, it's not just about what you did, but also what you learned from the experience. Reflect on how this challenge taught you the importance of teamwork in a medical setting, how it reinforced the necessity of clear communication and the value of diverse perspectives, how it showed you that conflicts, when managed well, can lead to better outcomes. So, when asked about a challenging situation involving teamwork, don't shy away from the question. Embrace it. Use it as an opportunity to showcase your ability to work effectively in a team, to deal with conflicts and to learn from your experiences. Remember, it's not about the conflict itself, but how you contributed to its resolution. Moving on to the academic hurdle. Medical school is no walk in the park. It's a marathon filled with complex courses and concepts that can sometimes feel like insurmountable mountains. It's no surprise then that the academic hurdle is a common theme in residency interviews. The question isn't whether you've faced these hurdles. We all have. The real question is, how did you overcome them? Let's imagine you're in an interview and you're asked to describe a challenging academic situation you faced in medical school. You might think back to that particularly tough course. Let's say histology. You found it hard to wrap your head around the intricate details and the sheer volume of information. Initially, you struggled, your grades were slipping, and you were on the verge of panic. But then, you decided to take action. Remember, the interviewers are interested in your resourcefulness and dedication. They want to see your willingness to learn, even when the odds are against you. So, how do you demonstrate this? Firstly, talk about your strategy. Did you seek help from tutors or join a study group? Did you explore new study techniques or use online resources? Perhaps you started to break down the complex information into manageable chunks using flashcards or mind maps. Maybe you started to dedicate more time to the subject, studying late into the night or waking up early in the morning. Next, be sure to highlight your dedication, show that you didn't give up. Instead, you dug your heels in, committed to understanding the subject, and worked tirelessly until you did. This is a testament to your perseverance, a trait highly valued in the medical field. Finally, discuss the outcome. Did your grades improve? Did you start to enjoy the subject? Did you apply your newfound knowledge in a practical setting? Even if the result wasn't perfect, it's important to show that you learned from the experience and grew as a student and a future doctor. But don't stop there. Go a step further and reflect on what you learned from the experience. Perhaps you realized the importance of seeking help when needed, or learned a more effective way to study. Maybe you discovered a newfound resilience within yourself, a grit that you didn't know you had. And that, my friends, is how you tackle the academic hurdle. You show your dedication to overcoming obstacles, your resourcefulness in finding solutions, and your unwavering passion for learning. Remember, it's not about the obstacle itself, but how you respond to it. Show your dedication to overcoming obstacles and your passion for learning. Next, let's discuss the personal obstacle. This approach focuses on your ability to navigate personal issues while maintaining your academic responsibilities, a testament to your resilience and time management skills. It's crucial to remember that life doesn't pause when you're in medical school. You may have to juggle personal situations such as health concerns, family emergencies, or other unforeseen circumstances. The key here is to demonstrate how you've managed to keep your academic life on track despite these obstacles. Now, when you're confronted with the question, can you describe a challenging situation you faced in medical school and how you dealt with it, you might choose to discuss a personal issue. However, it's essential to approach this topic with sensitivity and discretion. Keep in mind that your goal is not to evoke sympathy, but to showcase your resilience, your problem-solving skills, and your ability to balance personal challenges with your academic responsibilities. For instance, let's imagine you had a health issue that required regular treatments during your second year of medical school. The situation could have easily derailed your studies, but instead you took proactive steps to manage both your health and your academic responsibilities. You communicated with your professors, negotiated deadlines when necessary, and maybe even utilized disability services at your school. You developed a rigorous yet flexible study schedule that accommodated your treatments and ensured you stayed on top of your coursework. In this example, you're demonstrating several key qualities. First, you're showing your resilience. Despite facing a major personal obstacle, you didn't let it prevent you from pursuing your medical career. Second, you're showing your problem-solving skills. You took proactive steps to manage the situation instead of letting it control you. And third, you're showing your time management skills. You managed to balance your personal needs with your academic responsibilities, a skill that is crucial in any medical profession. Remember, the personal obstacle isn't about the obstacle itself, it's about how you respond to it. It's about your resilience in the face of adversity, your ability to problem solve, and your capacity to balance personal challenges with your academic responsibilities. So, when you're asked to describe a challenging situation you faced in medical school, consider discussing a personal obstacle. It's an opportunity to show your resilience, your problem-solving skills, and your ability to keep your academic life on track, even when life throws you a curveball. In conclusion, when discussing the personal obstacle, keep the focus on your response rather than the obstacle itself. Talk about the proactive steps you took, the problem-solving strategies you used, and how you balanced your personal life with your academic responsibilities. This is your chance to show your resilience and your ability to balance your personal life with your academic responsibilities. Now we'll tackle the clinical experience challenge. Clinical rotations provide a unique environment where theoretical knowledge meets practical experience. This real-world exposure can often present unforeseen challenges that test your skills, resilience, and adaptability. Imagine this: you're in your first clinical rotation and you encounter a particularly challenging patient case. The patient is a 70-year-old woman with a complex medical history, presenting symptoms that don't align with any specific diagnosis. You find yourself in a maze of uncertainty, feeling the pressure of potentially making a mistake that could impact the patient's health. In such situations, it's vital to remember that you're part of a team. Consult with your attending physician, discuss with your peers, and don't hesitate to ask for guidance. This is a learning opportunity. So, how you navigate through it is as important as the end result. Or perhaps the challenge lies not in the complexity of the medical situation, but in a mistake you've made. Let's say you incorrectly recorded a patient's medication dosage in their chart, which was caught just in time by a vigilant nurse. It's a mistake that could have had serious repercussions. In this case, your response to the mistake is crucial. First, acknowledge it. It's okay to make mistakes. We all do. But what sets you apart is your ability to own up to it, learn from it, and ensure not to repeat it. Inform your attending physician immediately, correct the mistake, and take it as a lesson to double-check your work in the future. These clinical challenges can be nerve-wracking, testing your ability to maintain composure and professionalism under pressure. However, remember that each challenge is a stepping stone, shaping you into a better healthcare professional. So, when addressing the clinical experience challenge in your residency interview, discuss the situation honestly. Reflect on your actions, the steps you took to resolve the issue, and most importantly, what you learned from it. Did the complex patient case enhance your problem-solving skills? Did the mistake you made heighten your attention to detail? Make sure to convey these learnings in your response. Show your interviewers how these challenges have contributed to your growth. This will demonstrate your ability to turn adversities into opportunities for learning and improvement, a trait highly valued in the medical profession. Your ability to learn from these experiences and maintain professionalism is key. Remember, the goal isn't to portray yourself as flawless. Instead, it's to exhibit your capacity for growth, resilience, and the continuous pursuit of knowledge. That's what makes you a promising candidate for residency. Finally, let's consider the ethical dilemma. Ethical challenges can be some of the most complex and nuanced situations you face during your medical journey. Whether it's witnessing unprofessional behavior, dealing with a conflict of interest, or making a tough call in patient care, these moments test your integrity, judgment, and ethical reasoning. Let's imagine a scenario. You're on a clinical rotation and you observe a fellow student, a close friend, cutting corners in a way that could compromise patient safety. You're torn. Do you confront them? Report them? Keep silent, hoping they'll correct themselves? In such situations, it's crucial to remember your primary duty is to the patients. While it might be uncomfortable or even risk a friendship, you need to take action to ensure patient safety is not compromised. Perhaps your first step could be having a frank conversation with your friend, expressing your concerns. If the behavior persists, it may be necessary to report it to a supervisor or an appropriate authority. Now, the key here is not just what you did, but why you did it and how you felt about it. Illustrate the internal conflict you felt, the questions you grappled with. This demonstrates your ethical reasoning. Express your understanding that, as a medical professional, your primary responsibility is to the well-being of your patients, even when it's personally difficult. In your answer, also highlight how you handled the situation responsibly. Did you gather all the facts before making a decision? Did you consider the potential consequences? Did you seek advice or guidance? These details show your responsible decision-making process. Remember, the goal here is not to paint yourself as a hero, but as a reflective, responsible individual who can navigate complex ethical landscapes. Don't shy away from expressing the difficulty of the situation, the doubts you may have had, or the lessons you learned. These all contribute to your growth as a medical professional. And finally, reflect on the impact this experience had on you. How did it influence your understanding of medical ethics? Did it reinforce your commitment to patient safety? Did it change how you interact with your peers? This shows that you don't just experience challenges, but learn and grow from them. So to sum up, describe the ethical dilemma, explain how you navigated it, express your ethical reasoning, detail your responsible actions, and reflect on the impact it had on you. This approach provides a comprehensive, thoughtful response that demonstrates your integrity, ethical maturity, and commitment to patient care. Remember, the goal is not to present a perfect picture, but a real one. Your interviewers are not expecting you to be flawless. They're looking for individuals who are capable of introspection, learning, and growth. And an ethical dilemma, honestly and thoughtfully addressed, can effectively showcase these qualities. This answer can showcase your integrity and ethical reasoning. As we wrap up, remember that your answer to the challenging situation question is not just about the challenge itself, but about your response, resilience, and growth. Whether it's a teamwork challenge, an academic hurdle, a personal obstacle, a clinical experience challenge, or an ethical dilemma, it's your opportunity to showcase your problem-solving skills, commitment, and integrity. Reflect on your experiences and select a story that demonstrates your character and professional development. Be genuine, be reflective, and show your learning curve. Medical school is a journey filled with hurdles, but it's these hurdles that shape you into a competent and compassionate healthcare professional. Your experiences, your growth, and your resilience are what make you unique. So go ahead, ace that interview, and make your mark in the medical world. Until next time, keep learning, keep growing, and keep moving forward. As you embark on this exciting journey, remember that the preparation is key. Take your time, be thorough, and most importantly, believe in yourself. You've come this far, and a rewarding career in medicine awaits you. Thank you for joining us today, and remember to like, share, and subscribe for more content. Now that you're ready to embark on this exciting phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of residency program interview process and move one step closer to your residency goals. Good luck on your journey.